All right, good afternoon, everyone. Thank you for joining us for our weekly Wednesday COVID-19 media briefing. We have been doing these weekly news conferences since April 8th, and we are pleased that you continue to join us to hear from our county leaders about the pandemic. As always, County Executive Marc Elrich and Dr. Travis Gales, our County Health Officer, are joining us. This week, as we sometimes do, we have another speaker, and this week it will be Dr. Earl Stoddard. He is the director of the Montgomery County Office of Emergency Management and Homeland Security. So we'll start off this week with comments from all three speakers. Once we hear from all three, then we will take questions from reporters. If you would, please check out the Zoom group chat. There are a few messages there for our members of the media. All right, if we could begin with the county executive.
So I'd say good afternoon to everybody. Just give you a little brief update on where we are right now. We announced the beginning of phase 1 last week, beginning to see signs in the community of outdoor dining. I was able to have outdoor coffee the other day. I stopped by in Bethesda at one of my favorite places and had a snack late in the afternoon yesterday. So this is slowly starting to come back. We recognize that it is a challenge for a lot of restaurants who don't actually have frontage in terms of a wide sidewalk or don't have patios to open up something outside. So the county is looking at street closures and partial street closures in order to provide a larger environment for restaurants to be able to expand in. And we will be expediting any of the permitting processes that are needed to accomplish that. We're not going to let our processes get in the way of folks being able to reopen on this basis. So that is moving forward. I didn't see with my own eyes any curbside pickup, but I know that it's beginning to get implemented, and I think it's going to take everybody a little bit of time to adjust to it and figure out how they're going to handle it. Probably one of the biggest difficulties is a lot of small businesses don't have inventories or their products in an online format where a person can just go to a website and see everything they have and say, would you please deliver me that shirt, that pair of pants, or that piece of pottery to the outside. So I'm sure this is a little bit more difficult than simply allowing curbside pickup. People have to adjust to how they're going to do that. We have shared with the council an outline of what we think phase 2 and phase 3 could look like, and we're not prepared to discuss it. We're waiting for their input on this, and so we're giving them time to bring us comments, and we will look at what we can do and how fast we can do it. Again, it's all going to depend on what happens with rates of infections. Hopefully those rates go down, and hopefully we continue to maintain space in our hospitals. Probably the two most important things in making the decisions. Do you have room for a surge? And are we getting our cases reduced in general? We've also started to implement the wider testing. We have access to the test kits that we've talked about. We are talking with community partners about where we can move things out into the community and use partners in terms of being able to maximize access to these tests. So I think we're doing what we can to set the stage for an improvement in cases, and hopefully we will begin to allow more things when that time is right. And as we've tried to say before, is like the more people abide by what we're trying to do, particularly keeping your masks on and trying to stay 6 feet apart from people, those probably are the two biggest things in terms of slowing the spread. So I'll stop there and hand it over to Travis, I guess.
Good afternoon and happy Wednesday. Always a pleasure to be with you all and answer questions that you all have. And thank you for providing good quality information to the residents of our county so that they can make wise, smart decisions to keep everyone safe. I don't have a ton of updates this morning or this afternoon, but we'll be happy to answer questions. I do want to bring up a couple of things. So as the county executive mentioned, we have moved to our phase 1 steps. And our dashboard continues to be updated with our measures in terms of our progress with metrics. I do want to bring attention to one thing that we did make a change in terms of how they are presented to be consistent with the recent guidelines that the CDC has provided in terms of how the information will be reported. We continue to utilize 3-day rolling averages, which is consistent with what we did before. But the tweak to this and the change to it is that we are comparing, instead of comparing today with yesterday's 3-day rolling average, we are comparing it to what it was 14 days ago. And that's how we're getting our number of days where we have seen declines over a 14-day period. Now, I want to make sure folks at home understand is that we will continue to follow those same metrics. And as the county executive pointed out, the ones that give us the most heartburn in particular are the capacity issues in terms of our hospitals. But I want to caution folks at home to understand that when we're looking at how we move from phase 1 to phase 2, we're going to need to see more significant decreases in the number of our new cases, because we want to alleviate as much of the virus as possible in our communities, because the types of activities that would be introduced for a phase 2 approach increases the points of contact that people may have with each other. And so the more we can drive that number down, we will feel more comfortable opening up things to a wider degree to allow for more opportunities, whether that's sports and recreation related activities, shopping indoors, eating indoors, those kinds of things. You can imagine that as many of those opportunities increase chances for people to come into contact with each other, that makes it more likely that, or increases the potential for the virus to spread. So I want you to know that we're looking at similar metrics, but we want to see sustained significant decreases in those measures before we decide to move forward. But there's no magical timeline for that. As the county executive mentioned, probably over the course of a number of weeks that we will continue to monitor. We will continue to be transparent in terms of the data that we present on our dashboard. Another thing I wanted to highlight is we continue to expand our testing capacity. And as that grows, we are testing more people. In fact, this week, the most recent numbers this morning shows that we have tested over 65,000 individuals across the county. And we have the capacity to test at a minimum 5% of our population on a monthly basis. Now, as we've tested more people, we are seeing more cases. But the other number that we follow is the test positivity, and we're seeing that number continue to come down. The 7-day average, consistent with how the state is reporting that, is now at 12.7%, which is significantly lower than where we were over a month ago at over 30% of the tests that we were ordering coming back positive. We continue to work with the state as they launch the large-scale contact tracing effort across the state, working with local health departments. That goes live this week. And we continue to work on our other endeavors to increase access to testing, including our mobile testing arm, which we're working mightily and steadily to be able to stand up next week, to be able to provide options for testing that aren't necessarily tied to the vehicle's admission station, and allow us the opportunity to do pop-up testing in relevant hotspots. I'll stop there, but happy to answer any questions at the conclusion of the presentation.
Thank you, Dr. Gales. Dr. Stoddard?
Good afternoon, everyone. Thank you for welcoming me to this media briefing. I did one early on and haven't been back since, so hopefully, I'm not left off now forever. But thank you for joining us. I wanted to talk a bit about recovery. I've been designated as the county's recovery manager, meaning that I'm simply coordinating our recovery efforts from COVID-19 while we still continue to respond to the actual disease itself. It's really important to recognize that as we talk about reopening, we recognize the reopening is a very important part of recovery, but it is not the only part of recovery that we have to focus on. So when we think about, businesses reopening, just because a business reopens doesn't mean that it will survive long term because of some of the losses they've sustained or reduced business that they'll experience even when they reopen. And so we continue to focus on how we can make sure that we can deal with some of the long-term considerations, short, medium, and long-term considerations associated with COVID-19, the impact on our residents, the impact on our business, the impacts on our community. So to deal with that, we've established a recovery framework that does try to deal with the short, medium, and long-term implications of the virus and the associated economic impacts that we are seeing from the measures that have been undertaken to control its spread. So the framework, the beauty of the framework is that it does try to integrate members of our county council, executive branch agencies, our nonprofits, boards and commissions, and other community representatives throughout the structure so that we can build in this community feedback and feedback loop throughout the process as we engage in it. The framework itself has 5 major programmatic areas of emphasis: housing, health and human services, education, economic revitalization, and government operations and services. So thinking about the various issues that we have to deal with, obviously each of those sectors has its own set of short, medium, and long-term objectives. I just want to highlight a few because I think they'll be illustrative of sort of what we're considering in this framework. First, short-term, obviously reopening is at the top of the list. We want to be able to get our businesses open and operating. We also want to be able to reopen certain county services or reconstitute certain counties' work sites that will allow for some expanded services, whether it be in person or through increased engagement with the public. But obviously, we have to be able to make sure that our county work sites are as safe as we're expecting our public or our private sector venues to be. In addition, we know that childcare and summer youth programming are going to be incredibly important short-term issues. The childcare sector is not built to sustain itself on limited gatherings of up to 10. And so there are going to be long-term considerations about how that sector can continue to provide the services that we need them to provide in order to get people back to work, but do so in a safe, from a public health perspective manner, as well as in a manner that allows them to simply sustain their businesses. And so I would expect to hear more on the child care and some certain relief targeted towards the child care that we're developing as part of our recovery framework. Transportation is a similar concept where we have to look at the short-term expansion of ride-on services and other services to allow us to effectively do reopening. We know that many of our residents and our county employees rely on public transportation to get to and from work, and we have to make sure that our system will accommodate any increases in reopening and do so in a manner consistent with good public health practice. And so throughout this process. Over the medium term, and the county executive already alluded to this, evictions are going to become an increasingly important issue for us to consider, both commercial and residential. Obviously, the moratoriums are important right now, but those are not for perpetuity. There will be a point when those will end, and we have to make sure that we have systems in place that allow for people to stay in their homes or keep their businesses going. And so we want to make sure that we're looking at that heavily. In addition, we've incorporated education. The public school system, our Montgomery College, University of Shady Grove, will all be engaged together to talk about what does education look like over the fall as we approach it. Obviously, it's a medium-term concern. We need to have some strategies in place to either keep schools safe if students come back to them, or if we can't because the disease that won't allow us to, how we improve the e-education opportunities that we began offering in the spring. And so all of those options are being looked at medium term. Now, long term, obviously, we've got some issues too. And so health disparities have been front and at the front of what the COVID-19 epidemic has illustrated to us. Those are connected to the issues of racial equity and other things that we are seeing discussed nationally. And so the issues that we are seeing in COVID are simply an illustration of things that we are seeing protested every day in America today. And so we've got a responsibility to deal with those long term. In addition, we've got workforce development that will likely we know will have to occur in light of our new economic conditions in Montgomery County, where more businesses are going to want to do e-services or digital services, and are our workforce ready to participate in that new changed economy? And so there are things that we need to do short, medium, and long term. There are elements of even those issues that have short, medium, and long term portions to them, and we will make sure that we consider them all. So I'll stop there.
Thank you, Dr. Stoddard. Our first question today is from Chris Gordon with News 4, and that is for the county executive. Chris, hold on one second. We've got to get you unmuted. Wait just a sec. There you go.
Okay, I apologize for the background. I don't know who put it on. I think at
I
least
liked it.
I'm seeing a guitar. I know you like it because the first time we saw you have a collection of guitars, Mr. County Executive. And not wanting to waste time, I wanted to ask you what kind of things you play, but that's not for today. Today I'd like to bring to you, and also to the degree that I didn't know Earl Stoddard was going to be here, and whether it's relevant for Dr. Gales. Small businesses, they say, you stress equity when it comes to testing and the health, and small businesses are saying, retail businesses, that the first phase of Maryland's recovery plan allows for 50% occupancy. They say in terms of equity, they see the big boxes like Target, Costco, Walmart, selling not only essential items, but clothing as well. I talked to the owner of 3 women's clothing stores in Montgomery County who says, her spring inventory is already, probably, certainly can't be sold at full price. She has 25 employees that are either going to be laid off or maybe have to be let go. Given the fact that the state allows for 50% occupancy of some businesses with safety protocols, what can you say today in terms of can you give us a timeline? What needs to be done and when for small businesses to be allowed to reopen and participate in phase 1 reopening?
So, I have resisted from day one to put a date on anything because I don't know. And if Dr. Gales knew, I'm sure he'd tell me what the date was when everything would be at a level where we felt relatively comfortable. We know the governor opened from the very beginning. It's not just in his phase 1. In the very beginning, he allowed Home Depot, Best Buy, and a number of the big boxes to stay open, and he put no restrictions on them. I might have quibbled with that decision. I might have wanted some restrictions put on it, but it was what it was. But it doesn't mean that we should have enlarged the problem. And the problem with retail, to some extent, is the touch problem. You go through a store and you pick up something and you put it back down, and you pick up something else and put it back down. Having unlimited opportunities to do that pretty much presents unlimited opportunities for the virus to be spread. And that, I guess, has been our concern, is that we're trying to limit the opportunities for the spread of the virus. And notwithstanding what the governor did, it doesn't change that, you allowing one thing doesn't mean that you should allow everything. And to the extent that we can hold this off until our cases come down is really important. I would invite you, when you go to the county page, don't just look at the dashboard, but click at the charts below the dashboard. Travis didn't say it, I will. The use of a 14-day average tends to minimize the look of the problem. We know our cases are going down. I think it kind of exaggerates to some extent to the degree they may be going down. And so if you look at our charts, you will not see a straight downward progression. You'll see spikes, and you'll see, if you drew a line through it, pretty consistently higher than we would like averages in the number of cases. I don't know if Dr. Gales wants to talk about a target for that, at least, but from my perspective, those numbers need to get a little bit lower.
Okay, can I follow up though? Because what you said doesn't, I don't think they're asking for a day like June 15th or July 1st, but I think they want to know a timeline, what needs to be done in order for them to hold on until that date. They're saying that curbside pickup and delivery is not enough. Going online, they're losing money. They want to have like appointment shopping, steaming clothes, putting clothes aside for 48 hours if they're tried on, to meet some of those things you just said. So what do you say to small businesses who are basically pleading for the chance to bring in some revenue?
So I'll let Dr. Gales take it from there, but I'll just say that's why we are having a discussion with the council about what should go into the next phase. and how we should do this. I mean, everybody wants to be part of this discussion, and we're going to bring voices in so we can talk about it. I mean, we are open to ways that we can do things safely. And, you know, some of those things are interesting possibilities, but I'll let Dr. Gales maybe follow up on that.
Sure. I mean, from a health perspective, we certainly are sensitive to the economic realities that COVID-19 has caused over the last 3 to 4 months. But I can only speak to you from a health perspective. And the reason why we have pause for increasing opportunities for contact within individuals is our numbers are simply higher. And again, recognizing that when you look at the state averages, their number of new cases spread out, you're talking about jurisdictions who have very small numbers of cases, very small networks of potential transmission. We're simply not there. And our data does not support being able to open up to the level that the state has in terms of mitigating potential transmission. Now, as I mentioned in the opening statement, we are hopeful and that the numbers will continue to move in the directions that they're moving now, where we will see a significant decrease in the number of new cases. Part of this is we are aggressively testing as many people as possible to identify particularly those cases who are asymptomatic, to get them quickly isolated, again, to interrupt networks of transmission, interrupt the number of new cases that are popping up in our community so that we can feel comfortable and confident when we do open up, increasing whether it's at 25% capacity, 50% capacity, 100% capacity, that we have done our due diligence from the public health perspective to minimize the burden of the disease in the community. So in terms of what do we need to do to get there, that's what we need to do. And we've got to continue to stay vigilant in terms of making sure that folks adhere to the practices and principles that we put into place, including wearing face coverings in public to minimize transmission from person to person.
Okay, thank you all. Randy Bass with WDBM has a question for County Executive Elrich. Randy?
Sorry, you want me to start a new recording?
Yeah.
This is
Yes.
Hi there. I think I'm unmuted now. Good afternoon, everyone. And County Executive, a question for you. I understand that it was important to you to have a regional approach going into this. Are you happy with the decisions of other nearby leaders and county executives and mayors and things of the like?
So I think we all fall in different groups. I think that Prince George's County, Montgomery County, and the District of Columbia have all borne, a disproportionate share of these cases. And I think we've all pretty much stayed on track with each other. And I know our health officers talk to each other. I know that the concerns are shared across all the jurisdictions. There's an enormous concern that if one jurisdiction opens up and does things that somebody else doesn't, that you could have people flocking to one place and then bringing back cases that otherwise wouldn't have been brought into their jurisdictions. So I'm pretty happy with how we've coordinated. And I understand if you look at the governor's own chart, there are a bunch of counties, below us that then have about half the rates. Baltimore County, Baltimore City have, roughly half of what we have, and even a lower percentage of what Prince George's County has in the way of cases. But the lower 9 counties, when you start talking about St. Mary's and below, their cases from the beginning of the COVID are the number of cases we were thrown off in 3 days, to give you a difference in the problem. So there are a bunch of counties that are just in a different universe because of the way they're set up, because of the lack of urban areas, because of the spacing between homes and activities, where their caseload for this entire period is what we put out in 3 days. So there needs to be a distinction between counties with high burdens and counties with lower burdens. That's why I didn't object to what the governor did for the other counties, because to the extent that health officers thought it made sense, given the number of cases and given the local situation, I thought it was fine. But I think the 3 of us clustered around the district have done well. And I think I noted yesterday that Northam is not going to include Northern Virginia and what he's doing next. I believe I read that correctly, that Northern Virginia was excluded. So you could add them to the group of counties that just are in different situations than the rest of our states, both us and Virginia.
Okay, Caitlin Peets with the Bethesda Beat has a question for Dr. Gales. Caitlin, just hang on just a second for us to unmute your mic.
All right, can you hear me?
Yep.
Perfect. Okay, so I was a few minutes late to the conversation, so I apologize if you've already hit on this, but I did want to ask, with the large-scale gatherings of people protesting, you know, are you worried about any increased risk for people, you know, and then an increase in cases? And then does it pose any problems for you as far as contact tracing? Have you had any of those conversations?
Sure, Caitlin, that's an excellent question and one that we have thought through very carefully. So we have recognizing the increased larger gatherings over the last few days. And let me go on the record and be perfectly honest. There's a reason why people are protesting. There's a reason why they're gathering. And I know I may get in trouble with this, but I'll just be perfectly candid, as Earl mentioned, in terms of a health perspective. The reason and the passion that people are advocating and bringing their energy to these gatherings is shaped by a lot of different things. It's shaped by recent events that have happened related to how police interact with communities, but those events are informed by numerous other incidents over the past several years. It's basically, at this point, we can create a fill in the blank, and unfortunately at this point, but it's also informed by, from a health perspective, the ongoing health disparities that are manifesting in COVID-19. When we look at our data and see Black and brown folk disproportionately having higher rates of COVID-19, and Black residents in our county and across the country having higher fatality rates related to COVID-19, which are informed by long-standing health disparities that have been present for decades. So that said, yes, it does give us pause, you know, because you've got a large number of people who are in a space where they're coming into contact with other folks. We have provided guidance in terms of making sure folks understand that if you are going to be in such situations, to make sure that you exercise precautions in terms of ensuring that you have on face coverings, ensuring that you minimize the folks that you're around to the people who you share a household with, or that you are part of your intimate contact network, making sure to wash hands frequently, to stay hydrated, and as best as possible, minimizing yelling to minimize droplets coming out of your mouth that may come into contact with others. And that's consistent with, I know, the state of California, New York City, and a couple of other jurisdictions have put out guidance in terms of, if you're doing this, here is how you can do it safely. Well, certainly we do potentially expect that we may see a number of cases pop up from these larger gatherings. The incubation period for the virus is anywhere from 2 to 4 days to 10 to 12 days. So we are keeping a watchful eye out for this. In terms of contact tracing, yes, it does potentially add some issues there, because, as you know, part of that is we identify a case, we interview the case, and ask them who are the other people that they came into contact with. So recognizing these challenges, we are remaining vigilant. We are also looking at our numbers as they roll in over the next week or so in the context of these particular situations. So I know that's a long answer, but I wanted to provide context to you in terms of how we are looking at it from a health perspective. And I also just want to emphasize that part of the public health response in addressing this is not only addressing the short term, whether or not we're seeing increases of cases related to a particular gathering, but are we also doing the necessary work to address the different issues that are predisposing communities. For example, when I did an interview yesterday where someone said, well, you know, this is going to make cases higher in certain communities. They already are, unfortunately. The reality is that, well, again, when you look at the numbers, COVID-19 cases are disproportionately in many of the communities that are protesting. And you have to ask yourself, well, how is this all tied together? So I say all of that to say that the public health response has to deal with the short term in terms of infection control, but we also have to do with the long-term consequences to understand how those particular factors and drivers have contributed to long-standing disparities in pre-existing conditions that have set certain communities up to be disproportionately impacted.
Thank you, Dr. Gales. And as we always try to do after we have taken all the media questions, we try to take one or two questions from the public who is joining us, whether it be on Zoom or Facebook. So I'll read this one question from a woman. This is directed at Dr. Gales, asking, when will the county or the state start collecting data of pregnant women who are giving birth and whether or not they're COVID positive?
I think that's an excellent question. So, because part of the challenge is, I remember, again, it feels like years ago, but it was really only months ago where we started receiving questions about COVID-19 and pregnancy risk, and there isn't a lot of data. And there remains not a lot of data, but I do know that that information has been collected to some degree in terms of mothers who have delivered who had been previously COVID positive. I confess I don't know offhand if there have been any maternal fetal transmission of COVID-19 as a result of pregnancy. I do know there have been some cases where there have been some newborn infants coming into contact with folks, by newborn meaning somewhere within the 1 to 2 month period, who have become positive and had COVID-19.
Okay, well, we appreciate everyone joining us today on this media briefing. We thank our speakers, the county executive, Dr. Gales and Dr. Stoddard, and we will see you again next Wednesday. Next Wednesday, for scheduling reasons, we will be moving it up to noon rather than 12:30. So we'll see you here noon next week. Thanks, everyone. Take care. Be safe, be healthy.